Hey guys, this is actually Kyle with my brother's channel, Beyond Bipolar blog. So I actually wanted to have a good casual conversation with my brother. So my brother and I has been doing this series for adoptees. Obviously, we're Korean adoptees, and I really do believe sometimes a lot of the adoption and obviously the families that you've been around and the friends kind of does affect your mentality. So I truly believe that it does affect a little bit of who you become as an adult and all the traumas or whatever, all the struggles or even some of the blessings as well. But it got me thinking because we were interviewing with a Korean adoptee friend of mine, and she kind of was intrigued by Travis's suicidality and his suicidal thoughts. And she asked some pretty probing questions that kind of interested me, and I'll describe my feelings towards it. I I have struggled with sometimes suicidality, but not as much. I'm only on antidepressant, and honestly, it's not as common. But with my brother, since he has bipolar, what is it, one or two?
One.
So he has one, and according to him, he can't control those thoughts unless he's actually on meds. So it got me thinking when she was asking what causes uh, suicidality, and do you ever feel bad about being suicidal or guilty? And in my opinion, I think it's a very complex. They're very complex emotions, if you can call it a disorder. To me, I don't know if it's really a normal thing. Maybe it is a normal thing to experience, but in no state of mind when someone actually goes through it, they probably are not thinking the best. So with those complex emotions, I remember one time when my brother used to be pretty hot-headed. I guess I was too, because we kind of flowed back and forth between that. But anyway, I remember there was one time in group he was telling me a story where he was saying that he struggled with suicidality, and the lady kind of got upset and cried, "Why would you want to kill yourself for?" And I kind of wanted to know, aside from feeling like the fact that there's no way out, and why he actually changed the mindset, and maybe he could explain a little bit what suicidality is, why he was experiencing it, and a little bit more details of maybe the guilt from actually causing the family pain when you actually do go, or maybe the guilt of feeling suicidal. And with me, the way I react, I tend to get really angry. I get really upset when I hear someone I love that wants to die. That's kind of, it's probably not the most healthiest reaction, but that's kind of how I react. And I kind of want to know, based on Travis's past of the 12 years he's been dealing with bipolar, what is suicidality? Why did you feel suicidality? And did you feel guilty? And is it related to mood or what?
Suicidality is just the thought process of wanting to kill yourself and taking action. Usually that incorporates suicidal ideation, suicidal thoughts, they're called.
And I wanted to ask you, does suicidal thoughts depend on your mood, or are they actually separate?
I want to say there's some correlation when it comes to mood and the suicidal thoughts, but
But can you
give
be
me,
suicidal and depressed, or just suicidal and not depressed?
you give me suicidal, not depressed, but it's more common than not to be depressed and suicidal. And it's more rare to be suicidal and manic. It's just you're very more at risk of doing damaging things for your life, whether it's gambling or sexual encounters
So
or
explain
excessive spending or things like that.
so explain the stress the first time that you had suicidality when you wanted to hung that rope. Why did you feel like that was the only option? Did you think about the family, or what was going through your head?
What was going in my head is just, I drove to Virginia. It was 19 hours. I drove 19 hours back in one shot. That entire time I was getting less and less sleep. I just totally quit work. Uh I gave up on college that I was in, and the relationship didn't go well, so I just felt like in the end I didn't want to live anymore. It's pretty hard to say that that was something that was innately the reason due to chemical imbalance in my head, like genetic disposition, which is possible, but in the end, a lot of it was environmental, and
Really?
a lot of it was the lack of sleep. So, in that ties together.
So can you explain a little bit? So you felt like, can you explain being a suicidal person that's really no longer suicidal? Can you explain why do they feel like they need to do it? And at that time, do you feel like those feelings were lying to you, or it wasn't real? Or can you explain a little bit why other people experience suicidality and some go through it?
It's probably just based on experience and mood and emotions and environmental stress that is in your life. If you're stressed out and you feel like you've lost hope and you don't want to live anymore, you do think like you want to end your life. So because of that, I feel that a lot of people who are struggling right now maybe even think that life isn't meaningless, that their family doesn't, that they can't live anymore because they're just so depressed. They feel that they've lost hope and want to give up in life. I was like that, but to an extent, it was because of the fact that I was on proper medication, and at the time, I didn't really believe in it. In the time, meds didn't work at in the beginning when I first started the process, and things got coherently worse as time progressed. And I feel that the reason why people get down and suicidal, just it could be situational, and it could also be genetic or brain chemistry in the mind. But I still feel that if you really want to take control of your life, you got to take responsibility to take action to try to make your situation and life a little bit better. Whether it's going to a therapist, taking meds, trying to get proper sleep, trying to reduce your addictions, whether it's drugs or alcohol, things like that, it's really hard to overcome. But in the end, if you want to take responsibility of your life, you got to try to manage those things. And for me, I feel like meds was the surefire way and how I reduced a lot of my stress when it came to suicidal thoughts. Because in the end, you know, I'm no longer as depressed anymore. I feel
Or
like I have a,
suicidal? That's
I,
why I think you have a really good mindset. 'Cause I wanted to ask you because when you were suicidal, did you think about the family? Did you experience guilt? Like when you imagine like a parent uh has to see their daughter or son go through suicide, is it actually the parent's fault? Or what is actually some advice for people that are dealing with people with suicide? Actually, that's probably a good question there.
for people that deal with suicide, I feel like you know, you got to validate your feelings. People should validate you, and you need to get help as quickly as possible because the more you wait on it, the more likely you're able to actually make the attempt to commit suicide. I feel that being bipolar, you can't always control, you don't always feel like you have control, but in the end, you do have a choice and you got to make the right choice if you want to manage the situation or your life better.
So you're saying no matter how much someone is struggling, it still comes down to choice, you feel like?
It does come down to
You,
choice,
you
and
don't feel like some
and other
suicidal people don't have the
people that try to help you are not responsible for your actions. It's
Who told you that?
just a personal matter.
Oh.
Uh, Many people I've talked to that have like my therapist considered that if I ever were to commit suicide, that it wouldn't be their fault. It would just be a choice that I've made, and it holds no responsibility on someone else's life. But that doesn't mean someone as me who has those thoughts of wanting to harm myself. That doesn't mean that I don't think about other people and what would happen if I'm gone. I do think about that, and I'm sure many people out there do think about that. They do think about the consequences when they do in their life. But sometimes it gets so bad that I'm for most of what I believe is that if someone's suicidal, they likely had it quite a while. They didn't just have it in one day and then they want to commit suicide. It's been progressing over time, whether people are overtly aware of it or not. It's something that you have to be aware of, and surefire, you'll see signs someday if you know someone's experiencing it. It doesn't hurt to ask.
The thing about what Travis just ended there or said there at the end is it hurts. And I think suicide is kind of a family or connection thing. Whoever you're connected with or attached to it, doesn't just hurt the person that's experienced suicidal thoughts, it actually hurts the family as well. But I guess I kind of like Travis's logic where it's still a separate thing. It's the suicidal person that has to deal. It's the suicidal person in the end. It's still their responsibility and not exactly the family or the friends.
Mm-hmm.
So with for those experiencing suicide, uh, can you explain some of the risk factors? I know we've been doing already this, but I think we can review it. Some of the risk factors, the pros and cons, why you want to have someone commit suicide or not commit suicide. Can you explain a little bit about
Well, I think
why you made the choice to live?
for all the purpose of life is to try to live and live a satisfied and happy and productive life. I think that's what the whole scenario of trying to live is. Uh, but if you feel that's not the case, of course you want to feel like your life is meaningless and you want to end it. But in the end, I feel like it's human nature to try to live and try to connect to the world, try to find meaning, try to find purpose. I think that's in the end why we exist today, is just to form our own story. Uh, Having an ending isn't always pretty, but we all die. It just some people have a tendency to want to take that responsibility on their own hand, and others let that responsibility take care of itself. Someone asked me, what is it like to have bipolar disorder? Well, when you're bipolar, you do have suicidal thoughts, but at the same time, it's the depression, it's the mixed moods, or the uh, manic depressive thoughts that seem to overcome you. It's the anger that you seem to have, and you can't, and you're very resenting. You're jealous. That feelings get so intense that it impacts other people and their lives, and that's what it's like to be bipolar and interact with someone with bipolar disorder.
Could you explain some of the risk factors you came across suicidal people that try to go through it? Didn't they have like issues or broke their back or do you know stories about that?
A lot of the stories I hear is related to alcohol or drug use or even cutting. All these issues seem to be related to suicidal thoughts, because if self-harm is something that kind of eases the pain for you, then you want to keep continuing to do it. I feel like that's why people drink, that's why people do drugs, and that's why people cut, because they're trying to look for a release. And I feel from that release, it's only short term and temporary, which is why it's not good. You gotta find something long term, and it takes a very, very long time to get on the right meds for most people. And because of that, you gotta be patient, you gotta be proactive, most importantly, and you gotta seek out responsibility to take care of yourself, because not everyone is going to do that for you, and not everything is going to be handed to you. You got to go out and do that sorts of thing to find it yourself. And you got to have the courage to be able to reach out to people that you know that might be able to support you, like a psychiatrist, therapist, other types of support like ILS, or uh, other types of like mental health advocates, support groups, family, things like that that are more healthy for you. Of course, you want to stay from people that detract you from getting any results, but at the end, you want to try to maintain the idea that life will get better, and it'll continue to get better if you're able to find the right resources, the right coping mechanisms, the right medications, the reduction of addictions, the reduction of self-harm. Things like that could really definitely benefit your life in the long run.
So let's just imagine that someone's suicidal right now. They've been going through all the motions of therapy, psychiatry. I don't think they should give up, but when a person tells a person and they try to talk it out and nothing's working, do you 100% agree that they just have to go to the hospital and that's just that?
First and foremost, you don't want to tell people what to do when they're suicidal. You want to validate their feelings. You want to listen to them. For the most part, when people are suicidal, they innately just want someone to listen to them and to let them know how they feel, and to get that acceptance that they're experiencing this type of feeling. And though it may or may not go away, they're just looking for someone to validate them and to maybe give them self-respect regarding their human nature. I feel like in the end, if things get really, really, really bad, the option is the hospital. But if that's not possible, another option is just to
911 or
hmm?
911.
Well, the first option is 911, but if you know for certain that 911 won't be able to solve anything, the option that you really want to consider is hospitalization.
Which is why you want to go to the emergency room and go through the motions, and they'll set you up. And maybe you could describe a little bit. So a suicidal person goes to the hospital. What should they expect?
First, there's an intake. They take your blood pressure. They ask you certain questions. First, when you appear there at the emergency room, you got to tell them you've been suicidal, and they'll seat you down and set you up for an appointment. Then they bring you to intake room, and you see uh, a, you see a social worker, a psychiatrist, maybe a resident, maybe the security, and you're pretty much not forced, but you're required to go into your own scrubs, remove your wallet, your any
Belts.
electronics, your belts, your cell phone, things like that. So you can't harm yourself and you can't be influenced by outside sources. They do this to keep yourself safe. And then after that, maybe after a couple, maybe like could up to be up to 6 or even longer hours, is that they take you up to the room where you're supposed to be at. Now, this is not for certain for many other people. I don't know. This is the hospitals that I've been to, is that they follow this procedure. So they take you up to the room, you're there, they assess you again, and that's it in a nutshell.
So if somebody's screwed up, they don't have insurance, or should they still just call and get hospitalized anyway?
If someone doesn't have insurance, I still recommend going to the hospital. It's not like you gotta pay it up front right away. But there's certain procedures you can follow. If you look up like
Rule 30, rule
that Rule 21 is only for people that
drugs,
are
do a diagnosis.
on drugs or something like that. For me, I'm on Medicare and Medica, so hospitalization's covered on that part. Now, if you have a surefire disability through your doctor, you should be able to get on medical assistance, and that could definitely benefit you in the long run because they might be able to pay like 80/20. And if you're on disability, that actually might be considered primary care, and then the medical assistance will cover the rest, so you don't have to pay anything. They also cover med insurance as well and therapies.
So in the end, you do feel like taking your life, there's better options out there, and there are actually options that do work. That's kind of the emphasis of this video.
Committing suicide is the very last option you want to do for yourself. It's not the first option you think of. Now, the thing that you could really, really do to benefit yourself is to get help, is to actually not only get help, but to openly tell someone that you're going through a rough patch and you want to feel better. So if you reach out to the right people, you should be able to find that. There's a suicide hotline. There, you can text the suicide hotline. There's a therapist that you could procedurally set up with a psychiatrist to get you ready on medications, an ILS worker, an arms worker, things like that that will help assert you into bettering your life and giving you that right motivation to continue living.
So let's sum it up. Basically, I do believe, according to Travis, suicide isn't the only option. Two, if you talk to someone, and if you can't, go to the hospital. And for a person dealing with suicide, try to validate their feelings as best as you can. And 5, is there anything else that we need to address about suicide before we end the video?
Committing suicide is the very last option. It should be the very last option on your list. You can debate me on that, but for me, I feel like I don't want to die. I just feel at that moment I want to die. So it's like
Temporary.
It's temporary. The feeling will always have ebb and flow, so it's not always going to be that bad.
And the thing is, death is permanent, not feelings.
And I feel that you can reverse maybe a bad feeling. You can somehow have better days, but you can't reverse death.
So it's good to be patient, and things will look better. All right, so I just wanted to end this. Thanks, Travis, for sharing a little bit of feedback. I appreciate this good casual talk. Everybody hang in there. It seems like the world's going crazy with the Trump stuff, but other than that, thanks for watching our video, and if you like our videos, subscribe and like. Thanks, guys.